you planning on taking notes? Thank you.
So for those of you that don't know, Amity has been kind enough to help us on the back end of some of our task force efforts up to now. And talking with Michael as we were getting ready to prepare for this month's meeting, I felt like it was absolutely appropriate to acknowledge that help that she has provided. So thank you very, very much, Amity, for the help that you've provided for all of us and putting this out so that it can be watched later by individuals that are unable to attend. So huge thank you and a big shout out.
Absolutely. Thank you, Amity.
All right. So without further ado, we have got Ben and Quinlen.
Hello, my name is Ben Kolendo. I am the Matanuska-Susitna School District Head of Student Representation, and I sit on the Matanuska-Susitna School Board.
And my name is Quinlen Schachle. I am the president of the Matanuska-Susitna School District Student Advisory Board.
We are both extremely happy to be invited to attend and speak at today's meeting and are hoping to talk a little bit about how we believe the mental health issue among youth has a great influence on the opioid problem in our state.
We also plan to talk a little bit about what our school district, as well as other school districts around the state, could be doing to help with these problems.
We'll start off by talking a little bit about why mental health issues lead to youth becoming involved with drugs.
What some of you may not know is that an extremely high percent of people who are addicted to drugs are also often diagnosed with other mental disorders, including things like anxiety and depression. The biggest reason for this is people taking drugs to try to lessen their symptoms of their mental health disorders they suffer from.
About 50% of individuals with severe mental disorders are affected by substance abuse, and around 37% of alcohol abusers and 53% of drug abusers also have at least one serious mental health issue.
We know these problems are severely impacted by our youth's mental health, and we believe the environment our school district, as well as other school districts in the state, create in their schools is the root cause of this mental health issue.
When I was on the phone with Michael Carson, he asked me if I think the culture and limited activities available to youth in Alaska is the cause of the mental health issue among youth.
We think that obviously has a huge impact on youth's mental health, but before that can be even considered, we have to look at the bigger cause, the environment within our schools.
Within schools, students are faced with a high stress and high stakes environment and are stuck in that environment from when they arrive, which for most of the year, it's still dark out, till when they leave, which for most of the year, it's already dark out. Which due to that, even if the culture and lack of activities problems was solved, students wouldn't be able to use those to their advantage.
And putting aside when our students arrive and leave school, the environment and the stress our schools put on our students is unacceptably bad for their mental health and is what we believe causes students to go to the last resort of drugs.
When students aren't able to have an environment that is conducive to good mental health in their schools, it's almost impossible to make up for that outside of school. If a student leaves that environment within our schools, stressed and it's already dark out, how can we expect their mental health to not worsen, nonetheless improve? And if the lack of activities problem is taken out of the picture, how can we expect our students to be able to find motivation to do something good for their mental health after being in that kind of environment for that many hours?
When we look at our YRBS data, we see that about 25 to 30% of our youth in the Matanuska-Susitna School District, previous to COVID, didn't think that their friends would help them, would feel it wrong for them to use prescription pain medicine without a doctor's prescription. The numbers are about the same at the state level.
And an unbelievably high number, about 50% of youth in the Matanuska-Susitna School District thought they don't risk harming themselves physically or in any other ways if they use prescription pain medication without a doctor's prescription. Again, these numbers are almost exactly the same at the state level. Now I want you to take a second and think about that. 50%, that's every other kid. Every other kid didn't think using prescription drugs in the wrong way posed any kind of risk to themselves. And that's pre-COVID. Imagine what the numbers would look like now with the huge recession we see in youth's mental health over the past 2 years.
In a smaller percent, but arguably worse, 20% of our youth in the Matanuska-Susitna School District said that they had used prescription pain medicine without a doctor's prescription. That's 1 in every 5. And the numbers aren't much lower at the state level.
And we can tie all that back to the environment in our schools. Because like I said, if students can't have good mental health, nor a conducive environment for good mental health in schools, they can't be expected and couldn't possibly have good mental health, nor a conducive environment for good mental health outside of school.
I, as president of the Matanuska-Susitna School District Student Advisory Board, have helped make our students' mental health one of the Matanuska-Susitna School District Student Advisory Board's main priorities.
And I, as the Matanuska-Susitna District's head of student representation, and as a Matanuska-Susitna school board member, have consistently brought to the attention of the school board the problem with our students' mental health and suggested many solutions, as well as advocated that the Matanuska-Susitna School District not opt out of the YRBS, or Youth Risk Behavior Survey, which gives us and everybody else a great insight on how to better our students' mental health and prevent the opioid problem from getting worse.
We both would be happy to answer any questions you may have regarding our stance on students' mental health, our work and our positions, our organizations, or anything else you may be wondering.
Yeah, Michael?
Ben, I just wanted to have you repeat two percentages that you verbalized, and also Quinlen can reinforce these. I just want to make sure I heard them correctly and that everybody online heard them. 50%, 1 out of every 2 students, I believe you said, they don't see any harm in using prescription drugs, or was it drugs in general?
So it was 50% of youth in the Matanuska-Susitna School District didn't think or don't think that there's any risk if they use prescription pain medication without a doctor's prescription.
Got it. And the second one was that 20% are currently using prescription drugs not prescribed to them, or maybe misusing their own script. Is that correct?
So it's not current. It's 20% of youth in the Matanuska-Susitna School District said they had used prescription pain medication without a prescription.
Have. Thank you.
Mm-hmm. Is there any other questions? Yes, Karen? I think you're muted.
The 50%, that's rather alarming. Now, you said it was pre-COVID. Since we've had the DEA campaign, One Pill Can Kill, do you think that 50% would diminish with more education, or is that an age correlated thought process that invincibility will never happen to me? Just
Well,
your opinion.
You know, that 50%, it's talking about students who truly just don't think that they could harm themselves in that way. And I think that a lot of that just has to do with under education, but also unawareness of like how mental health can lead to drugs. And so I think that number, that was 2 years ago in the 2019 YRBS. So as all of you could probably guess, those numbers would be much worse now.
Thank you.
All right, is there any other additional questions for these two?
Real quickly, Ben and Quinlen, thank you very much for this information. You mentioned that you provided some potential solutions to the school board. What were some of those solutions and how were they accepted?
Well, you know, one of the solutions, my most recent one, just the one off the top of my head, is some schools in the Valley have been doing programs to better their students' mental health, and they're pretty diverse, like Colony Middle School out here. They've been setting up new ways of getting their teachers to be able to understand their students' mental health and getting counselors more educated on how to talk with students, and they're setting aside specific rooms for students' mental health. And so my suggestion was to the school board just that we look more and start focusing more on students' mental health. And I suggested that we look more on some of the stuff that Colony Middle School is doing.
And I believe that Colony Middle School principal was the principal of the year, correct?
Yes, she was. And this was all her idea, all this mental health stuff. And she's amazing. I've been meeting with her and her ideas are great. And I've been talking with her and getting some of that stuff in other schools.
Oh, wonderful. Oh, thank you for that effort. Great, great.
I have a quick question, Ben, or Quinlan. What are some of the barriers that you think? What are the stigma that you're facing when you're talking about youth and mental health?
Well, I think when we look at like youth and how they view mental health, a lot of kids don't even want to acknowledge it. Like if they themselves have a mental health issue, they themselves don't want to acknowledge it. But then when we're talking to adults about how we can help with these mental health issues, a lot of them don't want to acknowledge it, but almost in a different way, like in a responsibility kind of way. Because it's a lot of work to help deal with mental health. Like you can talk to Colony Middle School's principal. She has been doing a lot of work with that. And it's a lot of work and it's a lot of responsibility. And the issue's getting worse and worse and worse and worse. But the things that we have in action to better students' mental health isn't improving. So people could say, oh, well, 20 years ago it worked, but it's not improving while mental health is getting worse. So we have to keep getting better at helping our students improve at the same pace as mental health is getting worse. And that's something that's not going on. And a lot of people, I don't think, want to acknowledge that that our current systems don't always work.
Yeah, I feel like we're being put in like high stress environments, like we said in our presentation, and we don't have like a way out. Like for Colony Middle School, I know Miss Polk, the principal there, she has like a keep where students can go if they feel like very stressed or anxious, and they can just like calm down. And I feel like that's a really good way to help students just relieve some stress.
Very cool. Thank you, gentlemen.
Thank you.
Thank you both. So up next, we have Karl Soderstrom from True North Recovery. He is going to share with us an update on the Day One Center. Karl.
Hey everybody, can you guys see me, hear me all okay?
Yep.
Looking good.
Awesome. Well, I just want to really acknowledge Ben and Quinlen's efforts, man. Your voice is so valuable. Please let us know as a community and as provider groups what we can do to support those efforts, because we have to change the tide in our youth and in our school districts. And we have to be able to create a culture where not using is a popular choice and an okay choice too. So thank you guys both for your efforts and your hard work on changing the tide with mental health and substance abuse for our youth. So that being said, I'm a person in recovery myself, and I started using when I was 13 years old, and had so many issues throughout my early childhood and early recovery, and started in my 20s. And so the Day One Center and True North Recovery, part of our vision and our mission is to say yes when somebody says, I need help right now. And how our behavioral health platforms are currently set up are not equipped to handle crisis. They're not equipped to be able to stand up and say yes. Our system of care is set up in a way that we ask folks to fill out a ton of documents and get a bunch of stuff together, and then they can get an appointment on a schedule. And oftentimes people don't make it. This is how we lose friends and sons and daughters, and and how that cycle perpetuates. And so we asked James to come and be a part of the next step for True North, and that next step is building a center specifically around what folks need on day one. The Day One Center is a facility. It's about 7,500 square feet. It's right off of Broadview here in Wasilla. It is right behind Evangelo's Restaurant. It used to be an old birthing center, and so it's a 2-story building. On the top floor, we plan to have 8 beds for withdrawal management. So detox services, withdrawal management services, a place that someone can actually stay and receive the help that they need. Downstairs was a primary care clinic, and it's going to house multiple programs. And the premise is that it's not about what True North can offer somebody in crisis. It's about what our community has to offer somebody in need. And so these programs that are established at the Day One Center are aimed to help folks navigate any level of care and need that they may have that day. And so it could be a person in full-blown withdrawal and not knowing, where to go or how to get help. And maybe they've gone to the hospital and got discharged, or maybe they've recently been incarcerated and just released and have relapsed. The Day One Center will offer resources to those individuals or folks that are finally ready to make a change. Or maybe they're not ready to make a change. Maybe they're ready to explore options. The hope is that we'll have partnerships like the 4As coming out and being able to provide services in the building. And so the Day One Center will house multiple programs. One of those programs is our withdrawal management program. Another one of those programs is the Lazarus Collaborative. The Lazarus Collaborative is a collection of MATSU providers who have agreed to work on crisis cases and expedite their care for them. And so when somebody needs primary care, or they need to get plugged in for medication-assisted treatment, or they need access to psychiatric med management, we've got partnerships in place that we can expedite the process for them to get in and get seen. We also hired community care coordinators, and their sole job is to help individuals navigate all of the systems of care. Traditionally, we'll see like case managers in behavioral health, and oftentimes case managers, are working with individuals, helping them accomplish things within.
Who are you
that.
talking to?
Are you talking to me? All right, somebody's maybe not on mute. Can you guys hear me okay?
Yep, I'm muting them as fast as I can. Sorry, buddy.
Oh, it's okay. I'm talking to you guys. That's who I'm talking to.
And we're listening.
Okay. Hopefully I'm tracking, and feel free to stop me at any time. But the Lazarus Collaborative is set up to serve folks in multiple capacities. And it's really about identifying that individual's need and getting them plugged in. What we have are multiple gaps in the continuum of care. When we say maybe somebody gets released from prison, or maybe somebody gets released from the hospital, our behavioral health system is not established in a way that we can respond the same day or next day. And the Lazarus Collaborative Care Coordinators help navigate all of those different providers and those systems pre-treatment. So the Lazarus Collaborative will be there. Some of you guys are familiar with the continuum of care and what treatment looks like. For anybody to get treatment, they first have to have an assessment. An assessment kind of diagnoses their substance use disorder, or it can also diagnose mental health disorders. It can outline a plan and a level of care that would be appropriate for their needs. Unfortunately, this system has been backlogged for years. Before some of the efforts in the Matsu Valley, we would see these appointments 2 months out, 3 months out, 4 months out, just to have an appointment to figure out how much treatment a person needs. That is unacceptable. It's just downright unacceptable. And so we've pushed for same-day access to assessments. We actually have walk-in assessments Monday through Friday. We also have appointment slots. And so assessments will be, I'll answer that question in just a second. Walk-in assessments has been a cornerstone of services at True North Recovery, and we have walk-in assessment availability Monday through Friday. That will also be housed at the Day One Center. again, this is a walk-in shop where if you need an assessment or you need crisis care or you need withdrawal management or access to psychiatric med management, this is the place to go. And so
One-stop shop.
that's, I mean, it's a community center. It's a resource for everybody. True North will certainly be an option for folks, but there are a ton of great options in our community. There are a lot of behavioral health providers. There's youth services, there's primary care facilities, right? And what we need to do is help folks lay out a map, right? It's about helping folks determine where they're at and what's next and helping them get there. And that can come in a variety of different ways. And so as we build up this resource center, the community is obviously invited to be a part of. We're looking for partnerships with medication assisted treatment. We are working through right now a partnership to bring telehealth psychiatric med management on demand in the Day One Center. And so if somebody's out of their medications and stuff like that, this is a great place for them. Let's see, what else can I tell you about Day One Center? It's a peer-led organization. There is no wrong door. This is an environment where people can feel loved, where they can feel at home, where they can get supported. And we have to get away from this idea that we have a recipe to heal people. We have to engage people and help them with their goals and their needs. We talk about individualized care, but our system is not set up to do it. So we help figure out where people are at and what their needs are and help them, accomplish that. A good example of this is like, maybe Johnny really needs residential treatment, but he's just not ready to do that. Instead of telling Johnny, you need residential treatment, call us when you're ready, we get to say, well, what can we help you with? Are you willing to try XYZ? Are you willing to try a medication? Are you willing to address your physical health? Let's start there. And if you're unable to curb your mental health crisis or your substance abuse issue, we're going to walk alongside you until you get it. We're not discharging people or sending them out the door or telling them that that they have to do it this way or they have to do it that way. There are many pathways to recovery. Our goal is for folks to feel the love and give us an opportunity to help them increase their quality of life. So as this project comes together, we are still very much in the building stage. I will share that we toured the building, we prayed on it, and we asked our board. We said we really need to get this building. This could be a huge resource for our community, and our board came behind us and said, you know what, we're going to take a leap of faith. We're going to purchase this building and we're going to create a resource for our community. We have to step up today. We cannot stand around and we've got to stop evaluating everything and doing all these feasibility. We need to help. There are people in our community right now that need a place like Day One. And so we're going to do everything in our power to open those doors and get people connected. And so that's kind of where we're at. We're really hoping to start seeing services flow out of that building this summer. And we've got an incredible team of folks that are pouring into it. And so, we are certainly open to partnership. We're open to feedback, and we're open to working alongside anyone that's willing to help us kind of get it up and running. So let me check the chat here. There's a couple of questions. If it's okay, James, can I answer some of these, or how do you want me to move forward?
Absolutely. Janice had a question. Kara and I both responded, but feel free to address it.
Janice, your question is spot on. Will you hire people with just as involvement as care coordinators, particularly if they have completed peer support specialist certification? Absolutely. I would venture to guess that we have more folks with variances or checkered past than any other organization. That I myself am a successful reentrant. The reality is people need purpose. Recovery and community and purpose is built around spending time doing things that add value to their lives and to others. And so, We do have to navigate the background check unit through the Department of Health and Social Services, which sometimes presents challenges. But we just hired a guy that spent decades incarcerated, and he spent 1.5 years working with the Division of Behavioral Health and the background check unit to get a variance. And we absolutely put him to work. James says, yep. Yeah, basically said the same thing. Oh, and Kara did too. And Dar, yeah, I you know, Dar and Karen and you know, there are families out there screaming from the rooftops, and you guys are both some of those families. You know, please keep pouring into the things that you guys are doing and raising awareness, because we can't forget, right? Like we don't get to just move on. We don't get to lose our friends and our family members and pretend like it's okay, right? Like we have to honor them by doing something right now. And so we're super grateful, Dar, for you in our community and partnering with folks out here to stand up more services.
I think that the barrier to entry is the biggest obstacle that we all face dealing with the addiction issues. Is they get discouraged. It takes forever to get them into a facility.
Yeah, it's a huge barrier, you know, and the 1115 waiver has been really impactful. I'm actually a huge fan of what the division is trying to do. They created ways for organizations like ours to create and build innovative programming for folks right now. You know, I think full transparency, organizations historically have looked at billing rates to determine if programs are sustainable. And what the 1115 waiver has done is created opportunities for organizations like ours to be able to provide front-end services, and we are jumping up and down and screaming from the rooftops and setting it up. We've historically done stuff like that. We've been visiting the emergency department for years. We do a ton of outreach, and we do a lot of care that just isn't a service that can be billed for, but it's the right thing to do. And when you're willing to help people in that moment, you know, they come in and become a part of, and they stay a part of. You know, we're only a couple of years old, and we have multiple generations. We've got staff that served a client. That client became a staff that served a client that became a staff, and you know, we want to continue pouring in and helping build people up. And so it starts with day one, and the day one center is being built to say, yes, you can come in, moms, dads, brothers, sisters, folks that need help. And then lastly, we have to get out of our own buildings, and we can't expect that every person who needs help is going to come to us Monday through Friday, 9 to 5. We have to be willing to go to the emergency department. We need to be able to be willing to go into people's living rooms. We need to be able to meet folks for coffee and just say, hey man, I got well and you can too. This is what it looks like. And the more integrated into community we can be, the more impactful we can be. We do this. We've been invited to participate with My House, and they've been a great partner. And it's so much easier for a place like My House to say, hey, Carl, can you guys come down and talk to this guy? Than it is to convince some guy to go to another organization and start this process without knowing anybody or where to start or what to do. And so we need to be able to say yes today, and we need to be able to go out into our community and meet people exactly where they're at. Well, that's kind of an update on day one. I hope that's helpful, and you know, I'm just really grateful for everyone's support.
Carl, can you
Absolutely.
tell me, you mentioned Matt, are they going to have a full range of options from, you know, Vivitrol to methadone, Suboxone, Subutex? Is that what the plan is, to have that option for people?
Yeah, so that's, I mean, it's a huge first step, right? We have to, behavioral health and primary care needs to integrate. You know, that is a premise that came from the 1115 waiver. You know, and so the vision is that actually, I met with Dr. Quimby today. Every doctor in the hospital, in the emergency department, now has an X designation and the ability to prescribe.
Right.
You know, and so, you know, for us, we're looking at medical care for multiple things. One of them being medication-assisted treatment, another being withdrawal management. You know, we have to look at a multitude of different needs when it comes to withdrawal management. You know, some folks might have a supportive family environment where they can be prescribed a slew of comfort meds and be able to engage in services from an ambulatory standpoint. You know, in fact, we've been working with Matsu Health Services, and they've been incredible. They've stood up a really great and robust ambulatory withdrawal management system of care, and they're doing a great job with it. You know, these are resources that we need to plug into. We need to be able to get folks on an MAT program or through withdrawal management so that we can get them on an MAT program. You know, the Day One Center is poised for folks that, you know, maybe exploring Vivitrol and just need to get 7 days clean, right? Having an environment where they can get those needs met is going to be huge. And so yes, the hope is that we'll be able to offer MAT from the Day One Center. It may not be True North. We're looking at partnership for that as well. And so more will be revealed.
So I'll jump in here. I was in that meeting with Karl this afternoon, Michael. And yes, all ER doctors can prescribe recovery-based medications for the 3-day basis without their waiver. And we might be speaking a little ahead of turn with sharing that information, but the waiver allows them to release them into the care of someone that's willing to connect them with an MAT provider long-term. And that is the kind of partnership that Day One is seeking, is being connected at the hospital at a level where they can reach out to our care coordination team and say, hey, we've got someone here that's interested in MAT. And if they're willing to engage with you or another community provider, we're willing to get them set up for this long-term, as opposed to the 3 days, to really get a foundation set and allow a community-based provider to get them established with a recovery community.
Thank you, James, for that addition.
And then, so the final talking point that Karl missed, Day One is going to house essentially 7 programs that are all going to be focused on entry into a recovery lifestyle, right? Some of those programs are still in development. Some of those things haven't been released to the public, but we're talking about essentially the quickie mart of I need help. And it is going to be absolutely amazing.
Congratulations.
Yeah, I'm super excited about it. We're even putting a bathroom and a laundry room in there, and James won't give me the combo, but there's a whole like slew of like food and snacks, and sometimes people need an ear, a sandwich, and a shower, right? And we can love on folks in that way, and when they're ready to take next steps, they know where to come.
And to answer that question, Michael, your last one, who the prescribing provider will be, more will be revealed on that. We've had lots of discussions with multiple providers that are interested in contractual services. It doesn't really make sense for us to venture very far off into the medical field. That's really not our expertise. So that is another area we will be seeking partnership, and we have not identified one, but multiple that are interested at this point.
Yeah, and right now we're sending a lot of folks over to Matsu Health Services, and that program has grown exponentially. Janet's been incredible with that. And we've applied for a grant for withdrawal management. We're waiting to hear back on that. And so, you know, as those things kind of come to fruition, that'll be more telling of our ability to staff that portion of the Day One Center.
Wow. Congrats again.
Yeah, well, thank you guys, because again, this is a community effort. This is, if we do this right, this building can be a building for our entire community, not just True North and not just the people who need it. It could be a resource for family members. It can be a resource for providers. You know, what we do really, really well is we help people navigate, right? We're peers, we're case managers. We have all the clinicians and degrees and all the fun stuff too. But what we do really well is we say yes, and we help folks navigate and get from A to B. and we love them through that process. And so we're excited to do that.
A to B all the way to Z.
Thank you for taking the time, Carl. I appreciate you, buddy. Any other
Yeah.
questions before we move on to our next presenter? Todd, did you have a question? Your hand's up, bud. I apologize.
Oh, I just put it up, James. You're paying attention. So, I just wanted to say congratulations and thanks, Carl. When the governor, when we heard about these 1115 waivers and the governor got Commissioner Crum and the whole health team going on those and really trying to digest them. And it is great to see the Matsu once again kind of taking the lead in being creative and how we push forward on using some of these tools that are in place. So thank you for being willing to take that risk and moving forward. It's awesome.
Yeah, thank you. It's an honor.
All right. So next, we are going to have a kind of a report out and presentation on our community cafe. Elana, did I say it correctly?
Elana, yes.
I knew I was right the first time.
Yeah.
So I will make you the host so that you can share a presentation or whatever you need to.
Okay, cool. So thanks for having me, Michael and James. This is really exciting to be connecting with you all about community cafes because you were so instrumental in them in the first place in 2018. Before I get started, I just want to make sure I do an introduction. John Ruyak is on the phone. He is hired by the CDC Foundation to support OSMAP and this polysubstance use action planning. I think he's still on. Yeah, there he is. He's got a kid with him, so I want to make sure you can connect on that too. So we're excited to have him and be a team on this. And of course, we've got Director Hedberg here too, who's been really supportive of this process. Thanks for being here as well. So I've actually got a little presentation because sometimes it's easier to talk about something in pictures rather than just talking at you. So let me go ahead and share that real quick. All right. So some of you are familiar with the community cafe process, and it gets away from the town hall meeting. The town hall meeting is a place where sometimes the loudest voice is the one that's heard in the room. And we want to make sure when we do our action planning that all the voices are heard, even the quietest, smartest voice. So that's why we started to do these community cafe conversations in 2017. And this is a picture of one in Utqiagvik, and we use these big Post-it notes to identify what feedback we received. And so we're excited to start doing this for polysubstance use action planning. So it goes from this talk to action kind of view to really a process of ensuring that we're constantly getting the voices of people and then allowing other people to see those voices and garnering information out of that to produce action and reflection and exploration upon that. Honestly, it's based on the talking circle. Originally, I had just worked at South Central Foundation prior to coming to state of Alaska and learned a lot about talking circles. That's one of the predominant things that happen when you work there. And so it really connected with me and developing this statewide opioid action plan that we wanted to make sure we are connecting people, that we're not an audience just facing one person, that we're connecting in a circle together. And that's what heals. So talking circles, some of the concepts are that they're done in a complete circle. Only the person who has a stick is talking. A person gets to talk until they're done talking. And what is said is in the circle, stays in the circle, and the circle is used to discuss many different kinds of issues. But meanwhile, as we were doing these community cafes, we realized there's actually another method called the World Cafe method that most likely is also based on the talking circle. And so it's a methodology that is simple, effective, and flexible format for hosting large group dialogue. And I just explained it a bit of it. So we are using the World Cafe method. So in 2017, 2018, I'm just going to ground you in what we did then and then get to where we are today. So the idea was to learn of all the great success done in Alaska already. We wanted to get feedback from as many people as possible. We wanted to understand gaps and obstacles that communities were facing to addressing the opioid epidemic at the time. And ideally, just overall, we know that Utqiagvik is going to be totally different from Ketchikan, Kenai to Dillingham. They're all so different. You know, we need to make sure that we go to every community that we can and really understand where the protective and risk factors are in that community. So this is where we went in 2017, 2018. As you can see, we did capture a variety of voices across Alaska. And we use the strategic prevention framework to identify questions. And these are the different areas of that framework that we use to ask questions from. And we also did a strengths, weakness, and opportunities threat analysis based on the variety of areas that had come out from the Opioid Policy Task Force recommendations across the spectrum of care. And overall, we had met with 25 organizations and held 9 community cafes, and we heard the voices of over 300 people and got 200 large Post-it notes to transcribe. What do we do with that? So a lot of you were part of the Matsu Community Cafe. We rolled that up into a themed packet, and you can see here, this is the table of contents that included all the different communities that gave their voices and the different areas around that. These are some of the things that came out of that, like resources is either a really big need or a big facilitator. This just kind of connects the dots with what people indicated about resources. All in all, we gave that to 8 advisory teams and we came up with a statewide opioid action plan. And that is what we've been driven by the last few years. And so we really have been driven by the ground up by the people across Alaska, including the Matsu community. And here's some pictures from that Matsu Community Cafe. And as you can see, there is a facilitator and a note taker, and then people really connecting with one another about what particular issue is. More pictures. And as you also can see, our public health nurses helped facilitate this event. We also had members of the Matsu Opioid Task Force help us facilitate, and the Alaska Guard supported us in note taking. And we really did a lot with the action plan, and I'm just going to run through some of the things that we did based on the goals. So we really took a ton of opportunity to develop more trauma-informed care across different entities. For instance, recently we just trained 540 emergency responders on issues related to trauma. We really coordinated with our public safety partners. We also developed programs like Restore Hope and Linkage to Care collaboration program, where we support Fairbanks Fire Department and Anchorage Fire Department and teaming up with behavioral health partners to link people to care at point of crisis. We did a ton of provider education based on that plan, based on the Voices of Alaska. We have a pain and opioid management echo. We've done a ton of a few PSAs regards to pain management and developed different educational brochures, as well as developed a contract with the University of Washington to support providers in using their teleplane hotline. We've done a lot of harm reduction work in conjunction with the communities. Project Hope, as you know of, has, this is an older number, but we've distributed far more than 64,000 kits, and definitely way more than 300 lives have been saved because of Project Hope. And we have these opioid emergency kits, and extremely important right now. We have fentanyl test strips that are constantly distributed, and we're finding new ways every day to help people get connected into those. We've vastly improved our treatment system since a few years ago through, as we've talked about, the 1115 waiver and other resources, getting an expert out there for everybody. But a lot of this was based on the opioid action plan. We heard from folks on what we needed. And finally, we've built a lot of community of recovery. We still have a long way to go when it comes to ensuring that there are recovery communities, but this is definitely a main goal of our opioid action plan. So today we're in 2022. So that's what we've done so far. We also had a virtual opioid summit in 2020 to review the action plan, and we are using that data to inform this effort. So what we're finding and what we heard the first time was that opioids don't act alone. People use more than one substance generally to just kind of maintain quality of life and functioning overall. And so here's some data in regards to fentanyl. We see that overdose death rates counts increased 68% last year. And here is where they increased by. We have 192 people who passed away from overdose from opioids. But also we have to really consider that 153 people have passed away from meth involved overdose. And fentanyl is the main driver of these overdose deaths. Fentanyl is not just in other opioids and doesn't always just act alone. Often it acts with multiple substances. So for instance, 63% of the meth deaths involved, 63% of the fentanyl overdose deaths involved meth, 35% involved opioid pain relievers, 28% heroin, just 21% of deaths had just fentanyl alone. So we know that people are using multiple substances, or they have no idea that fentanyl is laced in their substance. So that is why we are now improving our statewide opioid action plan, editing it and ensuring that it addresses polysubstance use. And we are doing community cafes to do that, one of which is coming up on June 7th. Thanks to Michael's partnership, we have our Matsu Community Cafe coming up, and that's why we are here today, to let you guys know about it and just kind of give you a framework of why we're doing this, what we're doing. So we are going to, again, use the strategic prevention framework elements, understanding what the concerns are of the community and the unique community factors that support you in overcoming overdose, but also what puts people at risk for overdose in the community. And then we're going to use the SOAR framework this time, the strengths, opportunities, aspirations, and results, to better understand how we should improve particular areas of the opioid action plan that may have not been greatly improved since it was started. And so we are working with government event services to do this time, and they're working to market on radio and other venues about the community cafe. They're securing the venue. We're all doing the facilitation training, and we're also bringing state facilitators. But we do need support. We need partnership with our community task forces, and we need things like having people to be there to get trained on facilitation and do the facilitation itself, having people there to note take, and having some on the ground marketing support for people to hang up flyers, things that are more hard to do when you're not living in the community. And we have resources now that support us in this journey. So last year we developed, or in the last couple of years, we've developed a website focused on community cafes called cafesforoverdosprevention.org that really kind of talk about what these community cafes are. And we now have a planning guide that supports us in this journey. So that is it for me. And thanks for listening to all of that. And I'd love to look at the chat, see if there's any questions. Okay. Oh, yeah, Michael.
Thanks, Elana. And so can you give us some details? You might not have them confirmed yet. Time, what that time period will look like, food available, the important stuff.
So for food, as probably people know, state can't actually purchase food. So if there's any suggestions for a sponsor for food, we would love to hear that, because food definitely brings people to the event. So yeah, if anyone has any ideas on that. And then details, we plan on having it from 2 o'clock to 6 p.m. The location, and John can correct me if I'm wrong, we have not definitely secured a location just yet. Is that right, John? Not sure if you can talk right now.
Yeah, I can talk, but if we do have a fresh COVID positive test in our house, so that's why I'm with my kid today. So if there's an interruption, I apologize. We're shooting for the Menard Center, I believe, but that is, I think we're still finalizing the date for the Menard Center.
Thank you, John.
Any other questions?
Can you make your PowerPoint available if you can share? Is that something that's shareable?
Yeah, I definitely can get that out to folks.
And then we have your email address. I'll go ahead and drop it in the chat if anyone wants to get in touch with you specifically on this community cafe. I know that you will get back to them.
Yes, and if anybody wants to assist Elana with any kind of facilitation, taking notes, some of you may remember the first community cafe, we had it at Pathways High School in Palmer, and there were many volunteers that helped out that day. So if anyone can be available on that particular day and that particular time, please reach out to Elana and give them a hand. Thank you.
What was the date range that you're looking at to do this?
So it's definitely set for June 7th from 2 to 6 p.m.
Aha.
Figured venue.
First Tuesday of the month.
Hey, Elana, if you would click on the 3 dots at the top right of my picture and make me the host again. All right, if we don't have any additional questions about our community cafes or for Elana, we are going to move on and hear from Sandy Snodgrass about her meeting with Senator Murkowski and some of the federal legislation stuff that's going on. Sandy, the floor is all yours.
Hi, I think, can you hear me now? Hi, my name's Sandy Snodgrass, and my son was one of the 100% fentanyl poisoning deaths in 2021. To my knowledge, he'd never looked for fentanyl or knew he was taking fentanyl that day, but his autopsy did report 100% fentanyl that day. So I've been doing anything I can to raise awareness about fentanyl since his death. And to that end, I was able to get Lisa Murkowski on a Zoom session with Michael Troster from the High Intensity Drug Enforcement Area Program in Alaska. And because of Mr. Troster and my story, Lisa Murkowski's office has agreed to stand up and introduce what is going to be called Bruce's Law in the federal legislation. Hopefully there will be a press release out in the next 2 weeks at the outset. But as we know, federal government doesn't always move as quickly as they even think they're going to. But Bruce's Law is specific to fentanyl. What it will do is amend existing laws that are already on the books that provide grant funding all across the United States So the change will include fentanyl-specific grants that nonprofit agencies and coalitions, task force can apply for to do education, outreach, interdiction, work with interdiction partners to stem the scourge of fentanyl. So I'm really, just overwhelmed that she's going to do that. It'll be the first federal legislation to include the word fentanyl. There are no federal legislations that have the word fentanyl in them up to now. So Alaska will be able to be first. And I'm very encouraged by the last meeting that we had. She has moved the draft of Bruce's law into the ONDCP for final technical edits. And it has been moved out of the Health and Social Services Committee to the Judiciary Committee, which they are happy about. I don't pretend to understand much of this. So really, I'm just reporting, not understanding. So they're very happy about that. And they're getting a lot of traction from all the stakeholders, all the entities in the federal government to pass this law quickly and bipartisan. So the last meeting that we just had Monday, they were able to tell me that Senator Feinstein from San Francisco looks like she is going to be the Democratic co-chair of Bruce's law. She is also the chairwoman of the Judiciary Committee. So they were very excited by that and feel that this law to provide fentanyl funding for the United States will be expedited because of Senator Feinstein's co-chair and the fact that it's going to go through her committee. So hopefully the next 2 weeks, there will be a press release and we'll really get more. At that time, we'll be able to have drafts of the law available to really understand how the law will impact the state of Alaska and the United States. But it is, again, it's the first, in my understanding, which is really shocking to me, that there is no federal legislation surrounding fentanyl at this time. So that's pretty short because I don't understand much about the federal government, but I'm very grateful to Senator Murkowski and the HIDA program in Alaska for what they're doing to stop fentanyl from coming into the country, specifically coming into Alaska. And I think that we are reaching people. A lot of people don't know about fentanyl, and I think that's changing quickly. 300 people a day in the United States right now are dying from fentanyl poisoning. And I think people are hearing that. And, we're kind of terrified to hear what Alaska numbers are going to be coming out late May, early June for the first quarter of 2022. So the sooner we're able to stop this, that we'll be able to save lives. I talk about it all the time that so much wonderful news has been shared today already about what we're doing about opioids and barriers to treatment and reducing stigma, and all of that is so important. But fentanyl won't allow us to help any of those people if we can't stop the fentanyl. It's a scourge. So that's really all I have. I'm happy to answer any questions if I can try to answer any questions, or if anybody has anything else they want to say about fentanyl, I'd love to hear it. And I really appreciate being on today. And I'm very, excited. It's not a very good word to use, but I'm very hopeful that we'll be able to save some lives very soon. And we're doing that now already. with just talking about fentanyl.
Thank you,
Sandy.
Sandy, for taking the time.
Yeah, Sandy, thank you. And thank you today for your dramatic testimony at the governor's press conference. My heart goes out to you and all the rest of the individuals, Dar and John and Karen, that have lost children. I imagine many task force members heard that Sandy is using the word poisoning. We are moving away from the word overdose because the word overdose indicates that somebody used too much. And with fentanyl, we know that it only takes 2 milligrams, and that could sit on the end of a pencil. And that's how powerful this drug is. And so that word poisoning lets us know that it doesn't take very much. And again, Sandy, thank you for your testimony this afternoon. It was very, very impactful. I wanted to thank you for inviting me to the roundtable with Lisa Murkowski's staff and all the other parents that were there, and really appreciate you taking this loss of Bruce and turning it around and turning it into something very positive to save lives in the future. So I can't tell you how much I appreciate your work. And thank you, thank you, thank you. Blessings.
Thank you, Michael.
All right, Janice, I think you had your hand up first.
Oh, okay. Competition. I love to be the winner. So I just want to say, of course, thank you, Sandy, very much for bringing attention to this and for taking it to the federal level. I think that's really important. Coming from the Department of Corrections for the state of Alaska, I just wanted to throw something in about harm reduction and how while there are great hopes that we can do something for people to not do something, if we can at least encourage harm reduction, that is doing something. And so I just want to say that that's something we're working on with our reentry unit for the Department of Corrections, is that harm reduction. So we're looking at, we give out backpacks, for example. So we give them to all the coalitions all around the state. Coming up on May 21st, there'll be the Success Inside and Out in the parking lot of Partners Reentry Center, where women can come and get information about a variety of resources. And we will have backpacks there. And items that we're putting in the backpacks are for harm reduction. So we're putting the fentanyl test strips in there. We're putting the nasal spray in there and information, brochures, information, whatever we can get, we're adding those. And then we had to chuckle because part of our harm reduction we decided was condoms. So we're throwing those in as well. Maybe no one else finds that funny, but I do. So I just want to add that. I don't know what the federal government's take on harm reduction is or on supporting it. I know there are grants out for purchasing the test strips and the nasal sprays. So, that at least there's that support. And that's something that I'd just like people to know. The Department of Corrections, we care about that. We care about harm reduction. We don't want people to be poisoning themselves. I'm glad Michael mentioned the use of the word poisoning rather than overdose. Words are so important. So, okay, that's all I have to say.
All right, Todd, you had your hand up?
I think Heidi was first. Oh, she put her hand down.
Oh, now you guys are just playing tricks on me.
Yeah, that's all right. No, Sandy, again, I wanted to say thank you also. And thank you for reaching out to the governor's office, and you have my contact information. So please feel free to reach out to me anytime if you think there's something that we can help you with from the governor's office.
Thank you, Todd. I think that Alaska being in the forefront of the fentanyl fight is really saying something about Alaskans, that we are not going to take this, that we are going to get in front of it. And the governor got in front of it today. And I so much appreciate that, Mr. Smolden. And I think it will show the United States who Alaska is, that we will not stand for our children being poisoned by fentanyl.
Sandy, did anybody record that? I wasn't able to be there. I'd like to watch that.
Todd?
The governor's press conferences are on his Facebook page. I know there were some audio issues at the beginning of the press conference, but if you just go to Governor Mike Dunleavy, the Facebook page, then you can find it there. And
okay.
I also want to say thank you to the health team in general. And I know Heidi's on here, and they don't praise themselves enough. But everything that we are really able to take advantage of right now with the 1115 waivers, just all of these things is because of a lot of hard work that they've done, and just dissecting those 1115 waivers and what they can be used for and how they can be used. Our health team, as many of you saw during COVID, of course, is top notch, but also in this area. And so I just wanted to say thank you to them publicly, and glad that Heidi's still on to hear that. But they are here to help you, and I know it's a big deal for them. So thank you everybody for your involvement, and please reach out to either my office or the health team, and we're here to help you.
I just wanted to let everybody know those 8 milligrams of naloxone Narcan kits showed up at the airport a week ago this past Friday on pallets, Project Hope. Tim Easterly is getting those distributed. Currently, they're at the 4A's office in Anchorage and some public health offices in Anchorage. And Tim and I are going to rendezvous maybe this Friday. We're going to do a drug deal in a parking lot, and I'm going to take everything out to my house, the place called my house, excuse me. And we're going to put those kits together. And then Kurt will be distributing those to True North Recovery, the public health office. So if anybody is looking for the new Narcan kits with the 8 milligrams of naloxone, please reach out to Project Hope at alaska.gov and make sure that you have those just in case you find a need. Thanks.
So I have actually a question for Mr. Smolden. Could you talk a little bit about the public safety alert that Governor Dunleavy spoke about today, and where people could find that, the governor's safety alert, where that's going to be distributed and what it says? Do you know?
I'd like to yield my time to Heidi Hedberg to answer that question.
Yeah, that's it. Thanks, Todd. And Todd, you are very sweet, but it takes all of us working together. No one person can tackle this. So Sandy, to your question, the community threat alert, we actually took the concept from Oregon, from the HIDA. Brand spanking new, as I mentioned at the beginning of this call. We're sending it out to, in fact, it just went out during this meeting to all of the schools. There's 4 different listservs that it's pinging right now. But we are working on developing the Office of School Health and Safety website. And so, we're going to try to get it onto the OSMAP website. So there isn't one specific site, but I'm happy to send you or put the link in the into the chat. It's also a part of the governor's press release. He has that link to the bulletin there as well. So you're going to see it in multiple places. We're trying to consolidate the web presence as we speak.
I'm just hopeful that as many people see that as possible. That's
the goal right now. I think it just hit about 8,000 emails. So it's it's moving quickly.
That's wonderful. Thank you so much.
Em, do you still have a question?
I just wanted to thank Sandy for her advocacy and joining us for the governor's press event today. I thought it was a really powerful event and kickoff to get messaging out to families and constituents in Alaska. On the recording question from Dar, we are looking for another provider that does have a backup, and we're trying to secure that backup, which has a little more clear audio. So once we get that, we'll have that made available.
All right, guys. So if there is no additional questions for Sandy, we will let Michael move into the announcements portion of our meeting. Michael, do you have anything to share with the group before we part ways for the evening?
James, I don't have the agenda in front of me, and
Okay,
do you
I
have
do.
that? Can you read off that? I'll let you as the co-chair. Also, I do remember though that there is the announcement about Amity moving into that administrative secretary position. Thank you, Amity, for all that you're doing for us. We really appreciate it. I really appreciate it.
Yeah, and I'll echo that again so that those that weren't here before, Amity has gone above and beyond to help us with technology needs through this time when we went to this virtual platform with the task force, making our meetings available to the public post meeting time so that they can watch a recorded version. It has been a huge help. So thank you again, Amity. All right, so for our announcements, anybody and everybody that is interested in Narcan, there is Project Hope. Reach out directly to Tim Easterly if you're interested in building kits, being a provider to distribute kits, becoming a trainer to train community members. His contact was shared in the agenda. In addition to that, we have Essential Peer Support Supervision Training coming up on May 10th and May 12th. That'll run from 9 a.m. to 12:30 p.m. Susan Masante is going to be the point of contact for that training. In addition to that, May is Mental Health Awareness Month. So a lot of our mental health providers in the community will be putting on events, and keep an eye out for those. And then it looks like that concludes our announcements. Janice, do you have something to share?
I do indeed. So I saw Susan Masante's name at the bottom. So I wasn't sure if you were going to bring her training up or not. So I'm wondering if her training is approved through DBH so that people will be getting their certification through it. If you don't know, that's fine. I can always email her to ask.
It is, and Crystal Smith sent me that.
Oh, great.
Yep, so it's all above board, and yeah, a great opportunity for people to get involved with peer-to-peer work. So it's all the I's have been dotted and T's have been crossed.
Very good. And I'll put in a plug for Susan Musante. I first ran into her when I started running the Matsu Reentry Coalition. So it's been 7-8 years now since I did that. And Susan was a part of our steering team. And Susan has done some absolutely fabulous work with reentry and recovery. So if she's doing peer training, I'm sure it's first rate. I purchased her book through Amazon that has to do with reconciliation of families for those who have been incarcerated. And we've used that in a variety of ways. And then also just to let people know, kind of an unusual thing, we are offering peer support training to inmates. So we're offering that while they're incarcerated so they can get the certification while they're inside. And then our goal is to set them up with possible employers prior to their being released so that they can possibly do an interview and get their first day of work lined up before they even get out of prison. So that's something we're working on. And then we added some of our own curriculum to the program so that it covers not just peer support for recovery, but also peer support for reentry. And then we want to add a part because, again, the disproportionality of Alaska Natives who are incarcerated. I always like to throw these numbers out because they shock people, and I like to shock people so that I think when people are shocked, they do something about it. So, you know, the state of Alaska has about 14% Alaska Native American Indian population, yet about 40% of the incarcerated people in Alaska are Alaska Native American Indian. So 14% of the population, 40% of those who are incarcerated. So we'd like to add a chapter on peer support for working with Alaska Natives as well. So that was why I asked that question of Karl about whether or not they hire people who have criminal justice involvement. So we're happy to hear about any places that we can work with employers to hire people. We also have wage support, so we can pay for someone's wages for a while. You know, we have different programs available right now. Reentry is like I like to say, cooking right now. We have received grants, we've received state funding. So we have no lack of funding right now for helping people with rent, with transportation, with getting clothes, with tools. So, you know, this is a good time to ask DOC's reentry unit for financial assistance for individuals. So, okay, throw that out. And thank you, Michael. I love coming to your meetings because I learn so much. I live out here in the Valley. So even though I work in Anchorage and I'm statewide, I just love the Matsu Opioid Task Force. And I'm a longtime member and I'll just keep it up.
Thank you. And I hope to see everyone June 7th. That's the first Tuesday of June. So in lieu of having a Zoom meeting, hopefully we'll be able to see everybody in person at the Polysubstance Use Forum or Community Cafe. And we look forward to that. And I will make sure that I send out a notice well beforehand as soon as we get all the time, location nailed down. And remember, if you have any food connections, please let Elana know. And hopefully we'll be able to have some food and something to drink while we're there. So thank you for any volunteers, also for any facilitators, note takers, any way, shape or form that you could help out would be very, very appreciative. Thanks, James.
Hey,
Oh,
guys.
can I throw in one more thing? I'm sorry. I'll just give another plug for the Partners Reentry Center and the National Association of Women Judges who are doing the Success Inside and Out event. It used to be held at the Highland facility for like 10, 12 years, something like that. But because of COVID, it was not held. And then this year, they didn't want to just skip it. So it's being held in the parking lot of Partners Reentry Center on Saturday, May 21st, from 1 until 4 p.m. So any women who have been reentrants who are reentering now can come walk around. It's like a fair. They can pick up freebies from the different tables. And there's food, there's music, it's going to be a party. So if people want to show up May 21st, 1 o'clock, Partners Reentry Center parking lot.
Perfect. Thank you, guys. All right, guys, we will all see you on June 7th, hopefully in person. And if we don't see you until then, have a wonderful month.
Thank you, James.